Joining us in the studio is a pharmacist, Deputy Director, Pharmacy National Orthopedic Hospital, Igbobi, Lagos, Mr. Ekunife Kingsley. Welcome to the program.
Thank you, Millicent, for having me.
All right. Now, we're seeing loads of confirmed cases growing at over 10 million, the death toll over 500,000. At this rate, do we settle for vaccines, treatment, therapeutics to slow the pandemic, to lessen the disease's damage, or push to getting 100% vaccine?
Drugs production and vaccine production is a very complex multi-step process. And they must, whether in the pandemic, they must all go through the clinical trials. So these are for safety reasons. This drug are new, relatively new, and the disease is also relatively novel. So there must be caution. So in as much as there's a hope for the vaccine.
And we're racing against time.
Yeah, we have to use the tools we have to curb the spread of the virus. By testing and more testing, just like Lagos State government is doing. I must commend the Lagos State government. The governor and the Commissioner of Health has been in the forefront of this pandemic, and they've been excellent. Continue to do more testing, tracing, contact tracing, isolation, and treatment. It has been found out that contact tracing is, in fact, the most effective means of controlling the disease, because WHO has said that the best way of curbing the disease is by breaking the transmission from individuals to individuals. So by contact tracing, we should be able to get the people that know the virus. Because you cannot fighting a flame blindfolded. When you get people that are infected, then you isolate them. And by so doing, we curb the virus. So we have to use the tools we have while we also wait for the vaccines to curb the virus.
All right. Today, the U.S. is reported to have bought almost all the world's upcoming supply of remdesivir. It's said to be promising in handling severe cases of COVID-19, but doesn't this affect the global efforts?
Yes, of course it affects it. Remdesivir is not a cheap drug. So last check, it costs about $390 per vial. And each protocol or each treatment regimen is about $5, which costs in Naira equivalent about 150,000. So it's very expensive. Now, there's hope for Africa. There's a company in Egypt, Everpharma, that has gotten license from Gilead Sciences, the company in the US that owns the patency for remdesivir. So they're producing, and they've promised that in a couple of weeks, remdesivir will be available for the African market. But that just brings us to the issue of medicine security. So it goes to tell us that we have to look inwards. We have to look inwards at this time of pandemic and look for the opportunities that pandemic promises us. We have to be able to guarantee our own supply of quality medicines. This idea of importing over 70% of our pharmaceutical products is not acceptable. In as much as we're in a crisis, the crisis also presents with opportunities. And one of the opportunities is medicine security. When pharmaceutical companies in Nigeria should brace up to the occasion to go into manufacturing. And government should support them as much as possible to go into manufacturing so we can sustain our drug availability in this country. Because you see what has happened. Even the Egypt that is producing remdesivir, they've said that it's for the Egyptian market first. Their target is for the Egyptian market first. So we in Nigeria will have to also earn our respect. Let us get involved and see what we can do to produce drugs for our own populace.
All right.
That's when the world will respect Africa, when Nigeria earns its own respect.
We'd like to thank you, Pharmacist, Deputy Director, Pharmacy National Orthopedic Hospital, Igbobi, Lagos, Mr. Ekunife Kingsley. Thank you for joining us on the program.
Thank you for having me.